Hello and welcome to Pregnancy Info. Today we will discuss the gestational diabetes, its causes, symptoms, and what to do if you have the same problem in the pregnancy. So, first of all, we will discuss what is gestational diabetes. Gestational diabetes is a condition in which your blood sugar level becomes high during pregnancy. It affects up to 10% of women who are pregnant in the US each year. But before proceeding, we will tell you its major types. It is divided in two types. One is hypoglycemia and the other is hyperglycemia. What is hypoglycemia? Hypoglycemia is the condition in which your blood sugar level is increased and you have to take insulin or medicines to cure it. Another is hyperglycemia. In this case, the blood sugar level drops down and you have to eat some sweet things or drink some sweet juices. If you have gestational diabetes, then you have to understand what are the factors and why it is caused. Gestational diabetes causes when you eat, your pancreas releases insulin, a hormone that helps move a sugar called glucose from your blood to your cells, which use it for energy. During pregnancy, your placenta makes hormone that cause glucose to build up in your blood. Usually, your pancreas can send out enough insulin to handle it. But if your body cannot make enough insulin or stop using insulin like it should, your blood sugar level rises and you get gestational diabetes. This usually occurs at the week of 24 to 28. This is the end of second trimester. In this time, your placenta have the weight and your uterus is enlarged. So this type of problems can be created or caused. How to detect? This is a simple question that if you are a gestational diabetic person, then how can you find out that you are? So here is some test which the doctor prescribed. First of all, oral glucose screening test. By this test, you can be advised to control your glucose level. Another test is oral glucose tolerance test. It is the tolerance test of glucose. It's mean you consume the glucose in some quantity and after 2 hours, doctor will check that how much glucose has been consumed by your body and how much insulin was produced and now what was the level of sugar in your blood. So these are the tests the doctor prescribed. Factors causing gestational diabetes. Some factors are here which can cause gestational diabetes. If you are a gestational diabetic person, you have to know these factors. Number one is age factor. If you are above than 25 years old, then there are a great risk of gestational diabetes. If blood relatives are diabetic, for example, your parents or some close relatives are diabetic, then there are chances that you will be gestational diabetic. Another factor is PCOS, mean polycystic ovarian syndrome. In this case, you may also face this problem. Another factor is if you are already taking medicines like some medicines which produce sugar level or other kind of medicines you are taking. These medicines can cause the problem during this pregnancy. You have had gestational diabetes before. If you were pregnant before and you were gestational diabetic, then there are more probably chances that you will again be gestational diabetic person. If you have had Macrosomia before, Macrosomia means the baby with great volume than a normal baby. This was also occurred due to gestational diabetes. So if you had the child like this problem, then in this case you will also face this again. Another factor is the region you are belong to. If you are American, Asian, Hispanic, African, or Pacific Islander, then there are more chances to be gestational diabetic. Another factor is your BMI. If your BMI is above 30, then you are most probably go under the problem of gestational diabetes. Now, what are the symptoms of high blood sugar level? You should also understand these symptoms. Number one, you will feel too much thirsty than before. It will due to increased level of sugar in your blood. So if you are feeling too much thirsty, then it could be the symptom. Another symptom is peeing too often because due to high level of glucose in your blood, your kidneys has to work more and your urine will also full of glucose. Then you have to pee too often than usual. Feeling very tired This can also be the symptom, but it is also the symptom of many other problems. In fact, in pregnancy, many females are already tired, but if you feel extraordinary tiredness, then it can be the cause. Another symptom is feeling nauseous. It means that you feel nausea in second and third trimester, which are not actually the trimester in which the female can feel nausea. So, if you are feeling nauseous, then it could be the sign. Having blurred vision, this is also a symptom. It can also be the symptom of high blood pressure, but if your blood pressure is controlled, then you should check the glucose level also. Now, if you are diabetic in pregnancy, then what are the things to do? Some things are prescribed for you to do. Follow exercise plan. Throughout your pregnancy, get active as soon as possible. Aim for 30 minutes of moderate activity most day of the week. Running, walking, swimming, and biking are all good options. Healthy diet. Eat a healthy, low-sugar diet. Follow a meal plan made for someone with diabetes. Talk to your doctor to be sure you are getting the nutrition you need. Trade sugary snacks like cookies, candies, and ice cream for natural sugars like fruits, carrots, and raisins. Add vegetables and whole grains and watch your portion sizes. Other thing you have to do is monitor blood sugar level. It is very necessary that you should be aware of your blood sugar level. So make your fasting and after eating meal your sugar level and write down in a notebook and get advice from the doctor. Get advice with what to eat and when. It is also a good question that in this condition, what should you eat and when? So the timing and the diet chart will be provided by your doctor, so you should consult with him or her. Be sure to complete your postpartum care. This is also necessary because after postpartum, you can be permanent diabetic, so be sure that you should take necessary measures for postpartum care with your diet and sugar control. Hyperglycemia triggering factors. Some factors are there which are the cause of hyperglycemia, in other words, the low sugar level glycemia. So, if you are skipping your meals in the pregnancy, it can cause low blood sugar in your body. So, don't skip the meals and divide your meal in 6 parts every day. Eat very little. If you eat very little, then the required and the nutrient level you are absorbing is very much less, or you are consuming is less than the required, then you can be under the condition of hyperglycemia. Physical exertion can also cause the low blood sugar level. When you are doing extra effort or doing an exertion, then your body consumes more energy and more sugar level has been dropped. Baby can suffer from. If you are a hyperglycemia or hypoglycemic patient, then your baby will also suffer from some problems. You should also be aware of this. If your baby, after the birth of your baby can be hyperglycemic, it means his body can be hyperglycemic or with low blood sugar level. So doctor will monitor his sugar level after birth and control the situation. Jaundice is also the cause of gestational diabetes. So if your baby is jaundice victim, then it can be the cause of gestational diabetes. Another thing can happen with your baby is macrosomia, which I have described before, that your baby can be with a lot of volume and with extra weight. So if you are pre-diabetic, then you should take some measures. Switch to insulin type 2 if you are using insulin type 1. Then after gestational diabetes or in the next pregnancy, you can switch your insulin to the next type because it will do best for you in this case. Change blood pressure medicines. If you are taking blood pressure medicines already, then you should consult your doctor because there are some salts in these medicines which are not good for gestational diabetic patients. So change the blood pressure medicine if it is possible. And another thing, you have to take 5 mg folic acid in your early pregnancy, especially till 12 weeks of pregnancy. So include folic acid tablet in your diet and give attention to eat it. Target healthy weight. You should be aware of your ideal weight and make a target that what you have to attain or what you have to and deliver. Make sure all vaccinations are up to date. There are some vaccinations which are suitable for pregnancy and are advised by your doctor to take during pregnancy. So make sure that you have planned all the vaccinations or you have the appointments of these vaccinations. So you should take care of it. Show your all medicines to doctor. If you are asthmatic or you have some other problems, you should consult doctor and show your all the medicines you were taking before pregnancy, and if doctor will feel to change it, then he will advise you. Avoid alcohol and smoking and drugs. If you are alcohol addict or smoking addict, then you should avoid these in the pregnancy or especially in the case of gestational diabetes, because it can harm your baby and the growth of your upcoming baby. Go to your doctor more often. You should consult doctor on and off, because you should be in keen concern with your doctor, because your condition can be worse at any time. So you have the contact number of your doctor, or you should visit more oftenly. Risk in pregnancy. There are some risks in the pregnancy if you are gestational diabetic patient. Early birth or stillbirth of your baby. This can be the side effect of gestational diabetes also. Another bad effect or the thing can happen is the C-section or cesarean delivery, which is most probably done during the case of gestational diabetes, because your body is not able to bear too much pain and there are more complications. So doctor always advise you to undergo the C-sections. Now, another thing I have to tell you is that you have to feed baby within 30 minutes after delivery. This is because the baby was in the environment of too much sugar level, and after the birth he will be hyperglycemic. So you should give or feed him or her milk after the delivery as soon as possible. So hope I have given you all the details, symptoms, factors, and all the advices I have mentioned before. So if you like the video, then share it with your friend and family members, especially with the females that are pregnant and they need the advice. And also subscribe my channel for such more valuable videos I will bring to you. Thank you and take care.